My name is Bob Doman. I'm the founder and director of the National Association for Child Development. This little video is one of a series of videos we're doing relative to issues and understanding how to address issues and maximize the potential of children with Down syndrome. In this little segment, we want to talk about problems that are very common problems and almost universal problems that affect how the child learns to hear and process auditory information. Many of the children have structural problems associated with the ears, specifically problems with the size of the eustachian tubes, issues with small ear canals, and problems associated with fluid in the middle ear. This is a very common problem, and a problem often that is not addressed and often not discovered. Typically, our children, if there's any concern about the hearing, get an audiogram, a test to determine what they hear. And, as we'll discuss in later videos, this isn't necessarily very conclusive information. Relative to these structural problems, the more important testing is what's called a tympanogram. This is a very simple little test to indicate whether or not there's fluid in the middle ear. The brain learns how primarily to process different frequencies of sound, frequencies that are important to learn how to process, understand language, and to speak, primarily in the first couple of years of life. And unfortunately, it's these periods when the children are really small that we tend to have a lot of issues relative to the function of the ear. And fluid kind of comes and goes during these periods of time with many of the children. Often it's an issue from virtually birth until the kids are about 6 or 8 years of life. And what happens with this is the child gets inconsistent input. And because of the inconsistent input, the brain does not learn how to process the frequencies of sound properly. This leads to issues with receptive language, expressive language, with speech, and development of cognition. So it's a very, very big issue. So part of what you want to be doing is looking at the health of the ears. One of the signs you can look for actually is congestion. If your child is congested, the odds are your child has fluid in the middle ear. And you want to do regular baseline tympanograms to see if those ears are clear. One of the more common culprits and causes of these issues are actually dairy products. Most of our children with Down syndrome really cannot tolerate dairy products. It produces mucus, and that mucus produces issues with fluid with the middle ear. If we do not have the structure working as it should, the ear working as it should, we're not going to get the proper information to the brain, and then the brain is not going to be able to develop and utilize information as it should to produce the function you all want. The function being your child learning to understand what you say, your child learning how to articulate and speak clearly, your child developing good language skills, and your child developing good cognition. Okay, so these are all very important pieces, very, very important things that you need to be aware of and address as parents. Other aspects that affect the speech and the structure and the breathing and so forth are issues relative to jaw placement, palate, bite, tonsils, adenoids. All these can be really significant pieces. Many of the children, if they're checked, have large adenoids, which are blocking the eustachian tubes, creating more problems with the middle ear and fluid issues. Large tonsils are affecting the breathing. We're discovering that many of our children have sleep apnea and actually poor oxygen saturation. Poor oxygen saturation essentially means there's not enough oxygen in the blood for the brain to function properly or the muscles to be as strong as they should be or any of the physical function to occur as it should. So these are also important aspects. Part of what you're dealing with as parents of children with Down syndrome is that many of the individuals you work with pieces of your child and do not look at your entire child. All right, that's one of the important lessons we've learned in NACD, is it's mandatory that we don't look at the kids as pieces, we look at the kids as a whole. And if we lack function, if the function is not developing as it should be, we have to look at all the pieces and determine what pieces are affected with this specific child and how do we fix those pieces. You know, it's very easy to say, oh, my child is not developing as they should, the speech isn't developing and language isn't developing as it should, so maybe we should do more speech therapy. Well, maybe, but not necessarily, because if you're not identifying the issues that have caused the delay, the issues that very possibly on an ongoing basis are creating more issues for the child, you're really not going to get anywhere. So it's very important that you look at all of these pieces and be aggressive and make sure you're getting the guidance and assistance you need from someone who's looking at your entire child, who can help you determine what their needs are, what resources need to be brought to bear, and what you need to implement to address the problems, fix the problems, and have your child move along developmentally as they should.